Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Kris Seymour, and today we're joined by Kris Seymour, Director of Transformation and Project Management for WellStar Health System in the Greater Atlanta area. Prior to WellStar, Kris started on the front lines of Duke University Healthcare System, scheduling appointments almost 13 years ago. Since that time, she's worked in rev cycle at some of the best healthcare systems, including her alma mater, the University of North Carolina at Chapel Hill, and the University of Virginia, the whole tour of the ACC there. She also serves as that's right. She also serves as the Education and Board Chair for HFMA, the Healthcare Financial Management Association, and the President-elect for the National Association of Latino Healthcare Executives, the Georgia chapter. And in her free time, she also works with a local nonprofit called Gigi's House with the wonderful mission of providing a safe space to stop human trafficking of girls. Welcome, Kris. It's a real pleasure to have you on the show.
Good morning. It is nice to be here. I do want to add one caveat.
Please.
It is Carolina all the time. Doesn't matter where we are, what the university is. It's always Carolina blue.
Tar Heels all the way, huh?
Yes.
All right. That's awesome. Well, it's a great school. And certainly, there's no shortage of amazing sports teams to be able to root for over at your alma mater. They've had a heck of a run over the last, century or so.
Yeah.
Well, today we're going to be talking about digital transformation with a heavy focus on something that I'm really interested in hearing more about, which is how gamification is impacting patient engagement. So let's jump into it. And to start, I'm hoping you can share a little bit about your background and your current role at WellStar.
So as you said, my background has been in healthcare for a little bit now. I don't think I ever thought this was where my career was going to go at graduation. I have been in academic healthcare systems for a very long time. I've enjoyed it. Again, Duke, Carolina, UVA, and came down to Georgia in January of 2020, a beautiful time to relocate to a new area and a new job.
That's exciting. Absolutely. Yes, a very interesting
time. And started at WellStar Healthcare System. This job has grown and morphed into a lot of being the bridge to have conversations between the revenue cycle and all the branches. There are a lot of places that probably work in silos, but they end up fixing one thing to break another. And we have a wonderful setup. And, my role is to be the bridge between the branches to ensure that we are working efficiently and effectively. And when we implement change, whether that be from a implementation of a system or a change in a process or even a cultural implementation to, make it a greater place to work, we are doing so as a holistic team from a revenue cycle perspective.
That's awesome. And I know we're going to touch again on a bunch of different topics related to patient engagement and the patient experience. But where I want to start is the notion we've heard a lot about in healthcare in terms of patients becoming more like consumers. So that consumerism of healthcare. I'm curious, can you talk a little bit about that and how you've been able to optimize the processes to improve patient experience and sort of meet them where they are through your journey?
Even in my career, I've seen like this transition and even being in different areas and places and spaces to see that patients are customers. So, when they have more options, they have the choice of having you as their healthcare provider. They have the choice of saying, I prefer the parking at this location or the experience at check-in at this location. And that actually plays a more significant role than it probably did 10, 20 years ago. And also depending on where you are, right? When I was at UVA, we were probably the closest healthcare system within an hour and 30 minutes, if not, a little bit further. So, there's not as much of a fight in the market to have the customer base and to where they're going to go, but you still want to provide an optimal patient experience. But the difference between there and here in Georgia being there are 20 healthcare systems right here in the greater Atlanta area. And if you are not thinking about those things that is holistic of the patient experience, when they check in, how was the ease of finding their clinics? What they're getting from their doctor is, one of many things. What happens after they get their bill, what their statement looks like. All of those things are the reason they return, they don't return. They write a bad review on Google, right? Like all of these things play a true role. Because, if you would have told me you got reviewed as a healthcare system 10 years ago, I'd be like, that's not a thing. But like we fall right in line now. And if you're not thinking about those things, you are not, I guess, one, innovating or thinking about the long term, or even being, what is the word I'm looking for? You're being slightly closed-minded. I can't think of the other word right now, but you're being slightly closed-minded in your view of what this process has become and what healthcare as an industry has become. One of the main things that I think is important to focus on, I've said this a few times in a few places, so if it repeats for anybody, apologies in advance, guys. But people, patients, and process are like the 3 Ps that I think we as a healthcare industry should value. Because if you are valuing your people, which are your team, getting their feedback, engaging with them, since a lot of times they are your patients as well, and understanding what's even broken from a system perspective, process perspective, and then building those processes around the ways of that feedback to improve the efficiency of your team, they will ultimately be able to provide a better patient experience for those patients. And having people who care, have the energy, have the focus, have the motivation based on how they're treated, processes that are in place to be able to be more effective, them to be more effective in their jobs, is ultimately going to lead to better outcomes for our patients, whether that be from a health perspective or even their financial health perspective, which definitely plays a role in their overall health. And that well-being of the patient, like those 3 Ps, if we can continue to keep those front of mind, I do feel we will continue to innovate and move forward as a healthcare system, as WellStar, and also as an industry as a whole.
Yeah, I think that's such a valuable foundation to have that sort of informs the rest of the conversation and the strategy and all of that. And I'm curious. So I've got kind of a 2-part question. I know that in reading some of the material that you've published in the past, you have a real passion around fixing the processes sort of at the underlying, level that affect staff and affect patients. So I'm curious, I guess first part is, can you talk a little bit about how you prioritize those types of, technology innovations? And then you also talk quite a bit about the risks of adding technology to a broken process without fixing those underlying issues. So if you can talk a little bit about that too, I'm really, really curious about your perspective on those 2 areas.
Sure. I will tell you, I am a few things. I am a problem solver at heart and an undercover nerd. Like all of those things exist in one space for me. And seeing a problem and not fixing it, I don't know how to do with that. Like just remove me from the room at that point in time. If you have, I think there's a few things with that, right? Like you can tell a process is broken, not necessarily when you're in it, because you're doing the steps that you repeat. I find that's always the case where someone, like, death by 1,000 cuts for me is somebody saying, well, this is how we've always done it. Like, just stab me in the heart right there. Because if this is how we've always done it, then there's things that have changed, whether it be just the system you're working in itself, the industry as a whole, even programs, the patients have changed, right? Like there's so many things that have changed. So to say we do it this way because this is how we always done it is never have always done it. It's just not a good reason for me. I'm definitely a believer in lean, where we take a process and break it apart and try to figure out, well, where is the excess? Where is the waste? Where is something that we are doing repetitively that in that case, we can insert technology, automation, a bot, something that does not need a human touch so that we can use that human to do the more higher level skill things that truly need a personal touch or a person's touch. And I think that that's the balance, right? Like once we have taken a process and we have broken it apart, figured out where the waste is, figured out what the true steps are, and then gone back and say, here we can insert technology versus here we need a personal touch. Those are the things that kind of create the balance for me in having those conversations about where do we insert technology. And I think, when we are just saying, we'll put technology over this process without figuring out where we have inefficiencies, you create more inefficiencies, you create more problems, you create more waste because you just, as they say, you put a Band-Aid over it and that's never going to fix it, right? We need to go in and kind of break it apart and then assess where we are to figure out even what technology you need. Like if you're putting technology over a process you haven't examined, then more than likely you're fixing the wrong thing, right? Or even worse, you're spending a lot of money, time, energy, and effort on something that maybe didn't even need that. Maybe it was as simple as, I say as simple as like I could build one, but maybe it is as simple as a bot or a formula in an Excel spreadsheet or a BI solution. Like there's so many things that I think we overlook because we're like, oh, there's this new shiny thing and I want to use it. That's great. But is that the solution that you truly need? And, as my husband likes to quote, the unexamined life. You have to truly examine a process and look at it intensely before you are putting a fix in place that may do just the opposite. So that's kind of, long way to say, look at a process before you make it more inefficient by putting technology that doesn't address the process or the problem.
Hugely important, especially I feel as technology is moving at such a breakneck speed here in healthcare, but obviously in the world as well.
Yes.
So certainly a lesson that I think we can all learn from for sure.
I get so many upgrades to my phone at this point in time. I don't know what software version of what I'm on. And imagine if we were moving at that pace and, okay, there's a new technology, let's use it, And that I feel sometimes we see the new shiny thing. Like I talk about like AI is the new shiny thing. Like when people hear this word, they're like, ooh, buzzword, want to use it. But they're like, well, what do we do with it? Right. And I think that's where we have to take a step back and figure out, one, is it AI automation or just take it all out and put it back together? And I don't know that we always look at those things in that way, and really, really, really hoping that when we're looking at these new technologies, when we're assessing where the need is, we're doing so in a way that is truly addressing that need, to not make it harder for our patients, to not make it harder for our team members, which is what often happens when you don't look at that process.
Yeah, absolutely. So you have a really great article in Health Tech magazines, and we'll link to that article in the show notes. And in it, you discuss the role of gamification in patient engagement. So can you talk a little bit about that and some examples of how you're using that philosophy and that approach in your role at WellStar?
So that article was almost like not a brainchild, but it was kind of, how do we meet patients where they are? What is something that is going to truly, from a technology standpoint, help people to improve their overall quality of life, is going to decrease the number of times they're back in the hospital or in the emergency room, is going to create adherence, provide education. And it's like, oh, this thing that we hold in our hands all the time is something that can quickly be an access point. And I don't think people even realize right now, if you're wearing a Fitbit watch, you're already in gamification for healthcare, because it is tracking your vitals. It is tracking when you stand up, when you sit down. All of that is gamification. And I think to kind of pull that back and think about, well, where can we truly use that for, again, medication adherence? That's one of the main reasons people are back in the hospital, is they're not adhering to either their medication or what their discharge plan was, or what their even after surgery, what are they supposed to do to ensure that they're adhering to things to keep them from coming back in the hospital. And I play games all the time. I don't know about you, but that little bar going up telling me this is like my 7th daily time I've logged into the thing in a day, and I get my little badge and I'm all proud of myself because I've done it. Why can't we apply that in healthcare? Because it has the same effect, right? Like, you're creating community. If you're competitive like me, you will want to make sure that you're continuing that. And then there's a whole benefit of, you're improving your health. you're improving your quality of life. And there's a few that I looked at outside of like your Fitbit and, all the things that, are wearables right now that I think are really interesting and continuing to grow. And I would like to see to be more incorporated in some of the things that we do from a healthcare perspective. Sugars for diabetics, making sure they're checking those on a regular basis. That is a major thing with diabetics is they don't check their sugars. They don't know what they are. They're not monitoring their food. Leads to them being in the hospital, further healthcare complications, loss of limbs, all types of things, right? And I just hope that we are going to look at gamification in a way to provide that to our patients. Because again, people walk around with their phones, their alerts are on, their buzzes are happening. And if we can find a way to better incorporate that, I think as healthcare systems, like I know there are things that exist out there. And I think that's slightly probably where I struggle is the connection of the healthcare piece and the app on your phone. And if it's not a provider that's aware of it, that is able to say like, hey, pull up the app, or it's not linked to your chart in some way, shape, or form because there's a partnership between the two so that the provider can call you, right? Like if they see that you're not adhering to your plan, they can pick up the phone and call you and say like, hey, I see you haven't been taking your medicine, or they can send you an email, or something can happen where you're now becoming active to what is happening before they end up back in your office or making an appointment, or even worse, in the emergency room, right? And I think, and I don't know this is fully how you asked this question, so I apologize, but I think that's the piece that I am truly looking for from a gamification perspective, because there's a lot of great apps out there that are working to create this information, but then how do we bring it back to the facilities holistically is probably where I'm slightly struggling to see. But I think I put it in that article that there's a lot of things we can do to be able to move this out to our patients in a way that it can be adopted, and also in a way that we can also push education out to them to increase, our profitability. Like there's so many benefits to gamification and meeting people where they are, which is definitely head down in their phone. If you've ever met my 12-year-old and my 17-year-old. So I think there's the ability to build on this change in technology that is not as difficult as we may think it to be.
Yeah,
And
that's
again,
really
sorry if that was not fully the question.
that
So
was
I
that was great.
apologize.
No, that's fantastic. I think it's such a unique and creative approach. Sort of, it sounds like taking lessons from our social media interactions. To your point, I don't do the Fitbit, but the Apple Watch, closing those activity
Yes.
rings on a daily basis. I mean, there's so much of it that's sort of in your face on a day-to-day basis, and there's a lot of work and a lot of opportunity that we can still kind of learn from those other areas and bring it to healthcare. So I think it's always very fascinating to see how people take sort of the world around us and try to apply it to healthcare. That's a really fascinating topic to me.
And it's great technology, right? Like, again, those motivators are not ones that you can build by having a conversation in some cases, right? Like you can have a conversation with the patient for 20 minutes telling them, all the impacts. But once they leave that office, they don't hear you anymore. But they
It's
hear
like
that
they go
phone
back to
ding.
their phone and Instagram and whatever
Yeah.
else
They
they're
hear that
doing.
phone ding. They hear that notification. They hear something pop up and say, hey, have you done this thing today? And that is motivating to people. They're like, oh, shoot, like, let me, I got to log in today and do the thing that I'm supposed to do, or I'm going to lose my streak, or I'm going to lose my badge for those are things that strangely enough at a very low, frequency create change in people. It creates habits for people. It pushes people, to do the thing that you want them to do without you being the one over their shoulder handing it to them. And that value is just phenomenal, to be able to change a habit in someone. So the habit becomes, I take my medicine, I check my glucose levels, my A1C levels. Like I'm doing the thing that I'm supposed to do to ensure that I am going to be here at a high quality of life for longer, for, friends, family, and the world, just to be able to, for me to be a part of it. And the value of that is, I don't know that you can measure it.
I completely agree. Totally agree. And sort of going along with the theme of, technology and how, we can use it to improve the lives of patients, the lives of providers, so on and so forth. One of the themes that I know you talk about quite a bit, and obviously one that's hugely important in healthcare, is seamless access. And I know
Yes.
you and your team at WellStar have done just quite a bit of work on this. So can you talk a little bit about how you're leveraging those digital platforms to foster greater access, particularly in rural and underserved areas?
Thank you for saying that, because that even reminded me, just to your point. Yes. So we utilize MyChart very heavily. It is based off of our EMR system, which is Epic, which I'm sure anyone who is probably listening to this actually knows what that
You might
is.
have heard of that one before,
But
right? And
yeah,
you're right
maybe, maybe. But we use MyChart, and if you're a patient at most hospitals, you've heard of MyChart. And that is the kind of patient access portal to be able to view a number of things, everything from your bill to your tests. And I've been at organizations, or, been a part of organizations where it's built out to certain levels. And, it's depending on how Epic creates what modules, creates what upgrades, all of those things, what you actually implement, what you choose is valuable within your reach, right? At WellStar, there's a lot of things that they found value in that I think is remarkable, from telehealth and virtual care to be able to actually have virtual appointments with patients, to creating a system where someone can fill out, depending on their severity level, of course, but they can pretty much fill out a survey or answer questions from an access point within the system, have a provider review it and let them know, either we need you to come in, here's what's going on. And again, it's for certain diagnosis only. You can't, do it for, I have a lump on my head or something like that. But, if you are having flu-like symptoms, or your stomach is something to, some of the lower levels, you can definitely fill that out, get that feedback, know whether you need to come in or get get access to service very quickly, especially on, our schedules. Like I'm a millennial. That's what they tell me anyway, in this whole, age thing that they give us. But I don't like to wait. I don't like to talk on the phone. I don't want to be on the phone. I'd rather you text me. I'd rather get an email, and I'd rather you text me over even getting an email. And being able to fill something out, walk away from it, come back and have something that says, hey, go look at this. That's amazing for me, because mom, 3 kids, whole job, lots of community service that I try to be active in. And I actually have to be a wife at some point in time too. And hey, I don't have time. I simply do not have time to sit on the phone for an hour to figure out, what the whole time is, what the wait. I don't. And WellStar has done an amazing job of creating that access point to be able to get, to be able to do all those things, to be able to set an appointment, to be able to have a review based on what it is and get some feedback, within 24 hours, to be able to pay my bills, see my test results, know if I need to come back in, have annuals, even, from a perspective of making an appointment in ZocDoc and having it already accessed to my MyChart to say, hey, you made an appointment with the doctor within this system. We want to make sure that you know what it is. And then they already have my insurance. I don't have to fill it out 16 times. Like, I'm already in their system. And that is something that is the ease of access. And they're even growing that, I think, again, going back to meeting people where they are, they've just launched it in Spanish. Like, I tell people all the time, you would not want to hold an important conversation about your health in a completely different language.
Right.
And the Georgia area, Latino and Hispanic communities are growing so vastly and so rapidly here in Georgia. To be able to actually read about what is going on with you, your child, your family in the language that is native to you, that is invaluable. And it gives patients a sense of safety. It allows them to understand, to truly ask the questions in a way, understand the information and ask the questions that they need to be able to not only, as I said, understand what's going on with them from a healthcare perspective, but execute whatever that plan is, whatever that, the next steps need to be. And that can be life-saving, right? And I applaud WellStar for taking that step and to still be thinking about how do we grow that further, whether what those languages are that are our patient demographic need, and how do we grow that out further. And I think those are things that create access, allow patients, even in rural areas, to not have to come back into the office, right, to read whatever is going on with them or get those test results. And them to be, even from a WellStar perspective, to be able to make referrals within some of those rural areas for tests to be done and be able to still get those, review them, and provide, information to that patient. I will say WellStar is pretty big. So when we say that we're in a rural area, we do have a lot of facilities, a lot of hospitals, a lot of health parks. So we have a bit more of a reach than some hospitals. Like when I was in UVA. At UVA, you might drive an hour and a half to see your doctor, get what you need. You don't necessarily want to have to drive an hour and a half to get the results, right? And those are things that I think the technology, the access that we can give patients, whether it be through MyChart or whatever patient portal that they're using, through technology like using text message, using paperless billing. Those are simple things that we can do to improve the efficiencies of the process and also ensure that we're reaching our patients wherever their location is. And I think gamification only furthers that, because again, if we are meeting them where they are, which again, at their phones, to remind them of things that needs to happen, to keep them accountable, to motivate them to create healthier habits. I think those are things that are only going to increase our patients' quality of life, further our reach, and even our patient experience is going to amplify because of the fact that they will be motivated to do those things and move in those directions, and it will be done so by the organization that provides them with that technology.
It's really interesting. You touched on a couple of things that I want to come back to. This notion of, sort of personalization and the ability to meet patients where they are and almost like learning from our social interactions. Because I'm an elder millennial as well. And I'm with you. I mean, text, email, please don't call me unless it's, an emergency. So when
and
you
for
have
God's sakes, do not leave me a message. For God's sakes, do not leave me a message on voicemail. I'm not answering it. So anybody who's looking at this, if you left me a voicemail, I did not listen. I'm sorry in advance.
I don't even know I know my PIN anymore to get to my voicemail. So I'm right there with you. And I'm really curious. So, WellStar, you also mentioned that you serve such a diverse, set of patient demographics, diverse in every sense of the word. So I'm curious, what have you seen and what's worked well in terms of sort of applying that strategy of personalization, of learning from our social interactions? How does that relate to being able to cater to those really diverse patient demographics?
So there's a few things. This is not technology based, but I definitely want to bring this up. Our organization has what's called BRGs, or business resource groups. They're meant to bring together certain culture subsets within the organization to provide them a voice, to provide them the ability to address initiatives or change that may be, specific to that one. So for me, I'm a part of Unidos, which is the Hispanic and Latino BRG that is with WellStar. There are certain things within our culture that we have, right? Like there are certain things we want to celebrate, which is major for us. There are certain things that affect us more heavily than they may other, cultures or subsets, that we want to make sure there is some equity around that. And there are things that we want to ensure from a healthcare perspective we're addressing as an organization, whether that be internal with our employees or within the communities in which we serve. And that we have a lot. I think there's 11, maybe 14. Don't quote me on that number, but there are a few. They go from our veterans to our LGBTQ plus community, our Black and African American, our Asian and Pacific Islanders. Like it is a gambit, and it is vast, which I cannot tell you how much I appreciate, because that allows us a voice within our organizations to be able to affect this change and to communicate where there is a need. And it is amazing. And our diversity, equity, inclusion, and belonging team has done an amazing job of not just allowing that to be cultural, but even from a healthcare perspective. There are implementations that are going on right now that are coming out of that initiative that I can only applaud because they're needed. But without these groups that are able to identify it, push it to the forefront, and leadership being open to hearing it and championing it, I don't know that it would have happened. And it is amazing to be a part of it, to see that there is actually, because I think I said it before, like we're the team members, but we're also patients in most of these cases, right?
Yeah.
So to be able to be heard and to be able to impact true change within a community that is near and dear to you and you're passionate about, it is amazing. And WellStar has done a great job of putting into place this BRG implementation, which I think at this point is only about 2 years old, and really, being a motor, an engine behind it to be champions for it, to create real change. So to take that back, you're hearing these voices along with, we have what's called a patient engagement committee, which is true patients, right? Who are saying, this is my experience. This is what I need. You're about to make a change. This is my feedback on that thing. And those pieces, while they're not technology driven, they drive a lot of the change in our organization. That feedback allows us to meet people where they are, regardless of if that is needing to have something that comes to their phone or needing somebody to call them, right? Like there is a community that wants a phone call. They want to hear a voice. Right. And I think that is important because everybody is not going to accept information in the same way, nor are they going to communicate the same way. And we as healthcare providers in the healthcare industry just don't have the, I'll say the luxury, for lack of better words, to just say one size fits all. And I love that about us, because the more we are able to adapt and understand and create that diversity in our approach to healthcare, the more people we're going to reach, the better the patient experience is going to be, the better the quality of life is going to be for that patient. And that is ultimately what we are striving for as an organization, is to be able to serve our community in the way that they need it, not in the way that we see it.
I think, the buzzwords get thrown around a lot in terms of engagement and health literacy and health equity and all the other, sort of things that are important to, folks like us in the healthcare community. I think what's really interesting is that WellStar has such, a great sort of program that y'all have put around this. And I have to imagine that that there are just so many stakeholders involved. And you mentioned, patients being one of them, your providers being another, leadership. I'm curious about how you sort of take that stakeholder mentality and sort of infuse all of those different and sometimes maybe even competing, voices and priorities into creating a strategy as robust as you've been able to create.
I think one thing, I love the fact you said competing. You sometimes, even in something that is very near to you, you have to remove the personal, because it's not just you, right? Like you are not the only person in this sphere having these conversations, feeling these ways. And I think that is major, that my experience isn't the sole experience. So being open is a balance, because again, you're competing sometimes with your own thoughts of, well, I wouldn't want it this way, or I wouldn't want to have this experience. And at the same time, it's not you. That person could be in a different place, in a different space, and that can be the majority versus I could sit in the minority. So I think being very open to what are the solutions, the implementations presented, and then as I go back to, I am a nerd at heart. I watch anime. I love Excel spreadsheets. And I cannot tell you how much of a problem solver I love to be. You have to go with the numbers, right? Like Jay-Z said, numbers don't lie. So you have to go sometimes with the data. And the data is super important to understand, whether that is patient surveys, patient experience scores, whether that is return on investment on what you're making, what you're doing, or whether that's simply the KPIs that you're judging. You have to use that in order to balance the scales of what is good for me versus what is good for the whole, and those competing conversations that sometimes happen in your head. And I'm a big data kid, and I think that it is hard to compete with the numbers. And I know sometimes people can make numbers look funny, but again, if you're coming from a good place and it is truly your goal to create change that is impactful for the whole, as well as change that is going to do really good within the communities that we serve, you're going to take the numbers for what they are and make decisions based off of that. And that is probably one of the driving factors for me in some of those things, is to look at those numbers, however they may apply, and figure out how do we move that forward. Again, whether that is work culture score or a KPI around revenue collected, whether we got to make sure we're looking at things the right way.
As a fellow and proud nerd, I can absolutely agree with that. Data-driven decisions and being able to sort of let the facts inform the future, right?
Yeah, and again, we're go back to, we're going into a customer base, so where people spend their money, where they choose to put their dollar, says something as well, right? And we can't continue to say, well, I know that I'm right, when whatever that data may tell you is being very transparent that you're not walking the right path, that there is a problem. When a patient experience score drops 4 points after you implemented something, there is something telling you that there's a problem with whatever that thing is that you implemented. And being able to have not only that flexibility, but that open-mindedness to say, well, I thought it was a good thing, but the data is telling me that it's not, is how we kind of move change forward, whether it is to roll it back or to roll it forward. Those are things that are super important.
It's really interesting. So as we sort of close out this episode, I've got one more for you. And let's talk a little bit about the future and some things that you're excited about and seeing in the industry. Talk to me a little bit about, obviously, we touched on this earlier in terms of the pace that technology is moving. Is there anything that you're seeing, emerging technologies or anything like that, that you're excited about that you think are, will just be game changers in terms of patient engagement and the experience and all of that? So anything you're sort of keeping an eye on or that you're excited about that you want to share with the community?
Something probably kind of left field for anybody who knows me. I am really interested in the evolution of virtual reality and how we use that for rehabilitation, whether it is cognitive or physical, and how that grows within our industry. I think that is just this like vast space that we could walk into, right? That we are using virtual reality to not only improve whether it be cognitive results for patients or even the physical rehabilitation. And how do we use that and infuse that, and even in some places make it a game if we're really taking it back to, where we are. How do we use that to, or capitalize on that to improve healthcare outcomes and the patient experience? Because that is something that has grown so much. Like, I remember virtual reality used to be like this tube thing that people walked into, right? And then it became like this thing that you put over your head, like a helmet. And then it became this little bitty set of goggles that I actually own, which is very strange to me now, that you are in. And it's crazy. I will tell you, I almost ran out of a window. I was one of those people that was in the virtual reality space, and all bad, guys, all bad. But that just to me proves like, this is a growing technology, a growing industry, how real it is becoming, the ability to even behaviorally or, therapeutically, like, how is that going to look? Are we having virtual doctor's appointments in virtual reality? What does that look like, and how are we going to use that moving forward? Like, I'm very interested in what that is going to be, because there's so many things that can happen with that, right? And of course, I know that there are things that we have to be aware of, like patient health information and being protective and HIPAA and all those things. But I imagine as that grows and we grow, going back to being in rural areas, imagine being in virtual reality to have a doctor's appointment somewhere in the middle of a space where people can't get to or they can't provide services. Like, I can't wait. Like, I simply cannot wait.
possibilities are just incredible and endless, it seems, when you start
Yes.
talking about technology like that. Absolutely.
Again, all you gotta do is put on a set of goggles and not run out the window. It'll be great for us,
As long as we can stay within the four walls of where we're operating,
Yes.
everything is going to be fine.
Stay in the square.
That's right. That's right. Anything else you'd like to share with our listeners in closing here, Kris?
I think the only other thing that I would like to share is that I think the implementation of some of these things can seem very scary because they're new, because we are still figuring out how they work. I think you take it in bits and pieces. And not only that, you start it as a pilot and you can grow it, right? Like it doesn't have to be a big bang, let's do a thing. It can start small and grow piece by piece as you see how it fits for your patients, for your community, for your environment, for that experience. And I don't want people to be afraid of it just because it's new, or even to grab it because it's new. It is something that I think we should approach with some caution, be guided by our data and by the values of our organization, but to implement so that we continue to innovate for not only our patients, but for ourselves. And I think that is probably kind of the last thing I'll leave you with.
That's fantastic. Kris Seymour, thank you so much for joining us today. It was an absolute pleasure to have you on, and I hope that you'll come back and talk to us again soon.
I hope you'll have me. Thank you guys so much. This is great.
Absolutely. And thank you to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little bit more about Taylor Healthcare and the digital healthcare experience, you can visit us at taylor.com/digital-healthcare. That's our show. And until next time, this is Kris Seymour wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.